Hey, good morning, and happy almost Easter to all of you that celebrate Easter. I'll have you know I am wearing my Easter outfit, okay? See that? So I'm dressed up like Easter flowers. Let's see. So there's been many requests for the topic of seronegative arthritis. I'm going to be a little jokester today, a little bit. So first, I'm in my #1 recording studio right now, my car. I'm wearing my Easter outfit, but this is the first Easter I've owned it for. What else have I got for you? Politics, well, everything's a mess. No comment right now. And let's see, what else? There was something else I wanted to share before we got going. Okay. Somebody's apparently making a remake. One of the TV stations is making a remake of All in the Family. So all of you who love All in the Family, Archie Bunker and Edith and Meathead and all them, then you're probably somewhere between 40 and 80 years old. Because if you're in that age group, you would absolutely love All in the Family. You had a blue-collar guy who was probably intelligent but had no education whatsoever, who acted dumb as a rock and appeared like a racist, but he really didn't even know what a racist was. He'd call minorities used people. So maybe today's lecture will be devoted to used people. Used people know whose yous are, okay? Anyway, okay. So before I get started, there was something else. If I think of it, I'll have to get back to it. Oh, I know. Movie of the week, okay? So, since we have a little holiday time here, I'm going to give you a list of movies that, if you haven't seen, you really need to see. Okay, comedies. What's the best all-time comedy? Stripes. Hands down, Stripes. If you don't laugh all the way through Stripes, you should move to another country. Okay, after Stripes, you may like, you may not, but 10 out of 10, Cheech and Chong, Up in Smoke. And, let's see. For non-comedy, probably the best Vietnam movie, at least, is got to be Forrest Gump. And for prison movies, semi-funny, semi-serious, best movie has got to be Shawshank Redemption. If you watch these movies and you think they suck, then you don't need to watch me anymore because I can't please you. Okay, so I'm going to try and tell you now about seronegative arthritis. So this is really not an interesting topic to me, but it's very confusing, okay? And it's the way I describe medical school. I tell people that the first 2 years of medical school, you're actually learning a new language, and you're expanding your vocabulary, and you're learning the language that doctors speak to each other so that we can confuse used people. Okay, so then the 3rd and 4th year, they expose you to real people, and then those people think you're not too bright because we don't know anything at that stage. Honestly, we don't. So I'm giving you this heads up because seronegative arthritis is really a play on words. Okay, so we've already gone through several times what rheumatoid arthritis is. Real simply, it's a systemic inflammatory disease with a predilection to the small joints, typically with antibody positivity to rheumatoid factor and CCP antibodies. Okay, so that's rheumatoid arthritis. Then we have seronegative spondyloarthropathy. Okay, what does that mean? Well, sero, S-E-R-O, refers to serum or blood. So seronegative refers to negative test in the blood. And spondyloarthropathy, spondylo means spine, arthropathy refers to arthritis. So seronegative spondyloarthropathy, which is a category all to itself, is blood test for rheumatoid factor negative, involving arthritis that's inflamed in the spine. And then the topic you want to hear about is seronegative arthritis, or what I think you're all referring to as seronegative RA. Okay, so this is really kind of interesting and fascinating. So I want to go back to one of the definitions I just stated. I just stated seronegative arthritis and seronegative spondyloarthropathy. So if we substitute spondyloarthropathy for arthritis, then we can pretend we have a case of rheumatoid arthritis, and we can say, oh, we have rheumatoid arthritis, but the test is negative. Well, that's odd. Doc, how do you know it's rheumatoid arthritis and it's not gout or lupus or psoriatic arthritis? How do you know that? Well, first of all, from the get-go, the history is the same as rheumatoid arthritis or spondyloarthropathy, namely pain in the hands, wrists, elbows, shoulders, hips, knees, feet, ankles, maybe the butt, maybe the neck. These would be the more common areas. Again, key features: inflammation, inflammation, inflammation. So, what do I mean? Tenderness, redness, swelling, and warmth. That's the definition of inflammation. Most important thing is morning stiffness. If you wake up with morning stiffness for no reason other than you woke up, you're stiff, you're inflamed, okay? So, right there, you know the patient's inflamed, and you do their blood, and the blood all comes back normal. So then you give them anti-inflammatory medicine that has no pain-relieving qualities whatsoever. They get better. So immediately you know they have a blood test negative arthritis. They weren't lying. They came in with pain and inflammation. They got better with anti-inflammatory, but unfortunately it kind of sucks to be them because their blood just didn't show anything. So the doctor that doesn't know anything treats the patient who doesn't show anything, and the patient gets treated wrong. Okay, and those are the people that all get wrongly labeled with fibromyalgia. So, to continue this story here, seronegative arthritis, by convention, and seronegative spondyloarthropathy have frequently been used to some degree interchangeably. Now, under the heading of inflammatory arthritis, one of those categories would be inflammatory diseases such as rheumatoid, lupus, Sjogren's, scleroderma, myositis. One would be spondyloarthropathy, which would include, be careful and listen to this, ankylosing spondylitis, psoriasis, Crohn's disease, ulcerative colitis, sarcoidosis, Whipple's disease, occasionally and rarely Behçet's disease, reactive arthritis or Reiter syndrome, or what is simply referred to as HLA-B27 uveitis or iritis or iridocyclitis. Now, I mentioned HLA-B27. This is a blood test marker that, quote, can be seen in your condition but is not required for the diagnosis. So, in English, the test is semi-useless to everybody except me, because if I think you have a seronegative spondyloarthropathy and your HLA-B27 is positive and everyone else in your family has psoriasis, then I can make a very confidential, strong guess that you do in fact have a seronegative spondyloarthropathy or seronegative arthritis. So in rheumatoid arthritis, the rheumatoid factor and CCP antibody are positive. If they're positive, those are the people who do worse. Those are the people that get lung involvement, they get dry eyes and dry mouth, they get nodules, they get other organs involved. I've mentioned these in the rheumatoid tutorial lecture that I gave. The seronegative spondyloarthropathies, they don't do better or worse. Unless you're a woman, they tend to do worse. But whether your B27 is positive or negative, you can have a bad or a mild case of seronegative arthritis. So what's the worst? The worst would be psoriatic arthritis in the form of arthritis mutilans, where the joints don't just get inflamed, they become completely destroyed. You can see a pattern like that in a diabetic. You can see a pattern like that in bad gout. When I say bad gout, well, it's an oxymoron because there is no such thing as good gout. If you have gout, that's bad, because untreated, that's also the worst. So untreated gout and arthritis mutilans of psoriasis, those are much more destructive than rheumatoid arthritis. However, with today's new drugs, namely biologics, even arthritis mutilans can be controlled, and with a new biologic called Krystexxa, we can do very, very well if we get your gout early. And if you have severe gout that's been untreated for 30 years, we can help you tremendously. You have no idea how much help there is out there unless you actually visit and find out, you know, what you do have and how you really should be doing. My stable gout patients, honestly, they come in once a year, I check their blood, and they don't have attacks ever again the rest of their life, as long as there's no tragedy or something goes wrong where they have to miss their medicine. The rheumatoids, the psoriatics, the seronegatives, I don't have to see them more than once or twice a year. They get their medicines, they follow the directions, they're happy, they don't have side effects. So I'm not convinced that I've conveyed what seronegative arthritis is. So let's go back to the RA patient. The RA patient, as I once described to you, the joints involve these. Those knuckles, okay, I'm leaving out what you don't get in rheumatoid. You don't get the DIPs, which are the nail joints by the nails. You do get the PIPs, which is the middle one there. And you do get those that make the fist. That's called the MCPs. And you get the wrist and the thing near my watch that sticks up a little bit right about, hold on, let's see, that little knot that sticks up on the wrist. Maybe I have reverse arthritis because I can't find mine. It's called a proud ulna or an ulna styloid. So if that's inflamed, these are all features of rheumatoid arthritis. If a person has what looks like rheumatoid arthritis with swelling and tenderness and warmth, and they have it in these joints by the nails, the DIPs, immediately you eliminate rheumatoid arthritis because those joints are spared in rheumatoid arthritis. The reason they're spared, I don't know, and at this moment it doesn't matter. But what does affect those joints and can mimic rheumatoid would be arthritis from psoriasis, ankylosing spondylitis, Crohn's disease, ulcerative colitis, and the other seronegative diseases. Now, here's a curveball. This is like a trick question on a test. What about gout? Is that seronegative arthritis? Well, it is until you actually look at the fluid and you find the gout crystals, okay? So no matter what you hear, no matter what you think, no matter what you heard from the guy at Wawa or Dunkin' Donuts or whatever, gout is officially diagnosed by seeing the fluid and identifying the crystal or the salt, which is called urate, monosodium urate. You see it under a microscope. If you see that, then you have gout. Okay, there's various ways to prove whether or not that particular joint with those particular crystals are responsible for pain at that particular time. But that's not for this topic. That's that's for another day. I'm going to make you wait till the next holiday for that one, in fact. God, we're at 14 minutes, so we're not too bad. We got another 2 minutes maybe. So, you have somebody that for all the world looks like rheumatoid arthritis. You label them as seronegative RA. You start them on treatment and they actually do better. Then one day they show up at your office with some joint that's crazy swollen. You drain it and you find gout crystals. Well, all of a sudden you may have mislabeled them as seronegative RA because in gout you generally don't get a rheumatoid factor. Okay, that said, I'll quickly throw in that in my observation of 600 patients, 1.8% have concurrent gout and rheumatoid arthritis. Now, I emphasize this, even though this is known literature and this is well-established, well-published data. Back in the 50s, 60s, 70s, rheumatoid arthritis was treated with aspirin and aspirin-like products like ibuprofen. Tremendous doses of those drugs will lower the uric acid so that people never got gout. So therefore, it was believed that rheumatoid arthritis and gout, even up until the early 80s, it was believed that these two conditions were almost impossible to have together. They were mutually exclusive of each other, similar to rheumatoid arthritis and schizophrenia. We don't know why, but schizophrenics don't get rheumatoid arthritis. I wouldn't recommend being schizophrenic just to avoid arthritis, nor would I recommend getting RA to avoid schizophrenia, but it's a nice fact to know, especially if you're taking a board exam, or if you want to impress your friends at the Rotary Club, or the 4-H Club, or, you know, whatever club you belong to. Because, again, used people usually belong to a club. At least that's what Archie Bunker would let us to believe, I think. Or, though, he belonged to the bowling club. Okay. All right, stop laughing. All right. So, seronegative arthritis. I'm trying to really re-emphasize and re-emphasize this. It looks like rheumatoid arthritis. The blood tests are negative. And the way we know it's not rheumatoid, if it involves joints that are not seen in rheumatoid arthritis. And those are namely the DIPs, or the joints next to your fingernails. Those joints are seen in gout, other crystals, because gout is a crystal. So gout, pseudo-gout, and the spondyloarthropathies, which I've named 12 times already: ankylosing spondylitis, psoriasis, Crohn's, ulcerative colitis, and sarcoidosis. Those would be the main ones. Somebody better get me a tank of oxygen. I think I'm breathing carbon monoxide in my office here. Remember, the office is my car, or vice versa. Maybe I'll sleep in here. It'll be my apartment, too. Okay, so, oh, by the way, guys, I swam 2,000 yards today in 30 minutes. In my recovery, this is amazing. This is great. So that means I did 1,000 yards in 15 minutes twice without stopping. If you can do that, join me at the pool. And I'm probably older than you as well. Okay, I hope I addressed the topic of seronegative arthritis. It requires a history, it requires an exam, it requires an analysis by an experienced rheumatologist of your blood testing and the distribution of the joints involved and your response or lack of response to the various medications that are available. The name seronegative, it's spelled S-E-R-O, seronegative, means blood test negative. It doesn't mean you're good, bad, or indifferent. It doesn't mean you'll never develop something else. In fact, it usually is a warning to me to keep my eyes open to see what may develop down the road. So those people may develop psoriasis, they may develop Crohn's disease, they may develop anything, really. Hopefully, what you don't want to miss gout, which is easily diagnosable and treatable. But if you go too quick and you're lazy and you don't drain the fluid and you don't have the proper microscope at your office, you're going to miss it. Okay, I hope this all finds you well. I hope the Easter Bunny is there for you. I hope your chocolate Easter eggs are delicious. I told you what movies you need to watch. I told you that politically things are lousy right now. I don't know who's making all this money, but my taxes went up a lot. I don't know about you guys. So, enjoy the weekend. I'll probably sign out until Monday unless I get good topics, because I don't really celebrate or have any plans for Easter. Feel free to send in your messages, and I'll do my best to make the videos. Thanks again, and enjoy your weekend. Bye.